Hello class, and welcome to your Chapter 10 lecture. Today we're going to be discussing stimulants. So the learning objectives for today's lesson are that by the end you should be able to explain how amphetamines work, identify the FDA approved uses for amphetamines, recognize the major side effects of amphetamines on the brain and cardiovascular functions, explain what designer amphetamines and club drugs are, discuss the unique dangers of bath salts, describe why stimulants are used as performance enhancers, explain why changes in attitude toward cocaine abuse occurred in the 1980s, identify the stages of cocaine withdrawal and approaches to treating dependence, identify and compare the major sources of caffeine-like xanthine drugs, list the principal physiological effects of caffeine, describe energy drinks and their potential risks, as well as to understand the potential dangers of using herbal stimulants and the FDA's role in regulating them. By way of introduction, stimulants cause feelings of increased energy and a state of euphoria. They also release dopamine. Their short-term excessive use can cause restlessness, excessive talking, and even trouble sleeping. Long-term use can induce violence, danger, or psychotic behavioral effects. Some individuals have self-medicated different psychological conditions, such as depression or ADHD, with stimulants. So our major stimulants are referred to as uppers, and they increase alertness, excitation, as well as euphoria. These are going to be your Schedule 1 and 2 drugs because of their abuse potential. So first we'll discuss amphetamines. So much of the new meth that is showing up today is from Mexican drug cartels. It is nearly 100% pure, and it's only $5 for one hit. Amphetamines are a potent synthetic CNS stimulant, but they can also be legally prescribed by doctors for appetite control, narcolepsy, and hyperactivity disorder. So let's start with a history of amphetamines. Well, in 1887, it was first synthesized by a German pharmacologist, L. Italiano. In 1910, it became tested on laboratory animals. And then in 1932, the Benzedrine inhaler became available as a non-prescription medication for nasal decongestion. In 1949, this Benzedrine was discontinued. And in 1971, amphetamine-like compounds in nasal inhalers were withdrawn from the market. So these last 2 points here are because of the abuse potential that we discovered with amphetamines. So amphetamines were also sold to treat a variety of ailments due to lack of restrictions around this time of 1971. So it was prescribed to treat obesity, alcoholism, bedwetting, schizophrenia, morphine and codeine addictions, to treat head injuries, seasickness, persistent hiccups, and even caffeine mania. So World War II, it was often used by Germans, Japanese, and the British to combat fatigue. So this again became used, as we saw in one of our previous lectures, became used by our soldiers. Then in the Korean War, it actually became issued by the United States Armed Forces on a regular basis. So it's said that it's actually still available to pilots in the armed forces today. And in 1967, there were roughly 31 million scripts written for this as an anorexiant. And an anorexiant is simply a diet pill. So when we look at amphetamine as a drug, it increases the release and blocks metabolism of norepinephrine, dopamine, serotonin, and adrenaline as well as blocks the metabolism in the brain and the nerves. It causes arousal, alertness, and hypersensitivity to stimuli that are also associated with sexual feelings. It can cause psychotic mental disorders, such as behavioral stereotypy. So this refers to simple activities that are done repeatedly, such as cleaning an object, singing the same note or phrase of music repeatedly, and even categorizing things. Chronic high doses decreases brain content of dopamine and serotonin, possibly due to stimulated production of free radicals. So these free radicals are highly reactive molecules that simply damage brain cells. Approved uses of amphetamines are for narcolepsy, so this is someone who falls asleep frequently, as many as 50 times per day. For ADHD, so this is abnormally high levels of physical activity, an inability to focus, and frequent disruptive behaviors. Or for weight reduction, so it just helps to control one's appetite. Side effects of this can include abuse of the drug, as well as cardiovascular toxicities, such as increased heart rate, elevated blood pressure, and damage to small veins and arteries. When amphetamine is misused, so it can be readily and inexpensively synthesized in makeshift labs, which makes it so easy for it to be misused because you can obtain it pretty easily. It can be administered by several different routes with a more sustained effect than cocaine gives. So it can be administered orally, intravenously, or through smoking. Depressants are often used to counteract the hyperactive and jittery feelings that one gets when they misuse amphetamines. And speed is a commonly abused injectable form of methamphetamine. And methamphetamine is highly addictive. It's also cheaper and longer lasting than cocaine is. And popular recipes for making methamphetamine include many over-the-counter ingredients as precursor chemicals, and that just simply means they're chemicals that are used to produce the drug. The Comprehensive Methamphetamine Control Act attempted to limit the amount of precursor chemicals that were sold, as well as increase penalties for trafficking meth and trafficking those precursor chemicals. So this did help to reduce the number of small homegrown labs, but it had very minimal effects on the trafficking and actual sales of these drugs. So when we look at someone who is misusing misusing amphetamines, we need to talk about the patterns of high dose use and what that looks like. So the intensity and duration of the effects of that will vary according to the method of administration. Smoking ice, which ice just simply refers to a smokable form of meth, causes effects as potent as intravenous use, but they're more prolonged and erratic. The initial effects, or rush, can include a racing heartbeat, elevated blood pressure, metabolism, as well as elevated pulse. The high then can last for between 4 and 16 hours, and that's going to include feelings of increased energy and intelligence, more talkative, and maybe more powerful. So there's a difference between the initial rush one feels and the high. A run or a binge then of drug use can occur for between 3 and 15 days, where the user is going to attempt to maintain that initial high. So symptoms after the first day of a run can include teeth grinding, disorganized patterns of thought and behavior, that behavioral stereotypy we discussed, irritability, self-consciousness, suspiciousness, and fear, hallucinations and delusions that are actually similar to paranoid psychosis and can even be indistinguishable from schizophrenia. They can be aggressive and antisocial for no apparent reason, and there can be long-term damage to the brain's inhibitory control centers. At the end of a run, a user may develop an extreme rash, engage in prolonged sleep. They may feel lethargic and very hungry, and even severely depressed. Tweaking then can lead to extreme irritability, paranoia, and hyperpyrexia, as well as domestic violence. So hyperpyrexia simply refers to having an elevated body temperature. And tweaking is when one is on one of these runs or binges. They're just using a lot of the drug and consistently to try and keep that high going. So continued use of these high doses can cause weight loss, skin sores, the person to have poor oral hygiene, a deterioration of the teeth, which you may hear often or commonly called meth mouth, non-healing ulcers, liver disease, hypertensive disorders. They can experience stroke and even heart attacks and seizures, as well as kidney damage. These individuals are more likely to be involved in violent crimes than other types of drug users. And children of meth-using mothers experience very serious consequences. They can be born premature. They're less likely to survive. They're often temporarily removed to either foster care or child protective services. And there's possible long-term cognitive and behavioral problems they experience. Additionally, repeated high-dose use can cause permanent damage to the dopamine and serotonin neurotransmitter systems in the brain, causing persistent episodes of psychosis, as well as long-lasting memory, motor, and cognitive impairments or deficits. So how do we treat amphetamine dependence? Well, amphetamine users account for only 8% of all admissions. Typically, there are persons between the ages of 20 and 44 years. And most are referred by drug courts or other criminal justice system methods. So most are not self-referring to treatment. There are also no well-established pharmacological treatments for amphetamine dependence. So antidepressants have been used to treat the associated depression. Behavioral interventions have been found to be the most effective. So these behavioral interventions help to modify the person's thinking patterns, improve their cognitive skills, change their expectations, and also increase coping with life stressors. Other interventions can include cognitive, emotional, and motivational rehabilitation, as well as career and skills development. So let's discuss just a few other types of amphetamines. So amphetamines are frequently used with barbiturates, benzodiazepines, as well as alcohol and heroin. These are known as speedballs or goofballs. So speedballs are combinations of amphetamine or cocaine with an opioid narcotic, often heroin. Goofballs are similar. It's a combination of potent stimulants and narcotics, such as amphetamines and heroin. Designer amphetamines were actually outlawed under the Substance Analog Enforcement Act of 1986, and they have two principal types. So we have the two principal types. There are derivatives from amphetamine and methamphetamine that retain CNS stimulatory effects, or prominent psychedelic effects and CNS stimulatory effects. So this act made illegal any substance that was similar in structure or psychological effect to any substance that was already scheduled if that was manufactured, possessed, or sold with the intent that it would be consumed by humans. MDMA is one of these prominent psychedelic and CNS stimulatory drugs. So it's also been referred to as ecstasy or Molly. So these first became apparent in the rave scene in England and was first used and then transported to the United States. At the height of its use, around 1987, 39% of Stanford undergraduates had reported that they tried MDMA at least one time. Historically, it was used to treat anxiety and fear by some clinicians, even though it was never approved for marketing by the FDA. Current studies, though, do show that it has been effective for treating PTSD. This drug releases serotonin, and it doesn't cause the crash or violence that is typical of other amphetamines. Users of this claim that it diminishes their fear, but also increases their empathy. High doses, however, can cause panic attacks, severe anxiety, aches, rapid heartbeat, hostility, and even altered sleep, which can lead to long-term memory deficits and psychological disturbances. So other types of amphetamines include methylphenidate or Ritalin. So this drug blocks reuptake of dopamine and noradrenaline and is a Schedule II drug. This has been used to treat depression, narcolepsy, and ADHD, and has been shown to improve scholastic performance. High doses of this drug, however, can cause tremors, seizures, and strokes. Performance enhancers such as Adderall. These are amphetamines that are taken to increase physical and mental endurance. Again, typically to treat ADHD type conditions. And then we have bath salts. So bath salts have not been extensively studied, so their pharmacological effects are unknown. They can be ingested either orally, through inhalation, or injection. So bath salts are a stimulant containing a product frequently including synthetic drugs that are related to synthetic cathinones. These can cause a syndrome known as excited delirium, which is exhibited by symptoms of paranoia, hallucinations, psychotic behavior, muscle damage, as well as kidney failure and even death. Now we'll discuss another amphetamine, cocaine. So the largest cocaine epidemic in history was between the period of time between 1978 and 1987. Antisocial and criminal activities have been highly related to the use of cocaine, and it is highly addictive. So we'll go through the history of cocaine use. There are 3 eras to discuss. The first era is described as the time when South American Indians, dating back to 2500 BC in Peru, would actually chew on the coca leaves for its stimulating effects that was reportedly giving them more energy and motivation. The second era is from the 19th century to about the 1980s. So during this period, it was used in a wine called Vin Mariani that was heralded by the Pope, the Tsar of Russia, the Prince of Wales, as well as kings of numerous other countries, for its ability to free the body from fatigue, lift their spirits, and cause a just general sense of well-being. Well, it was also used in Coca-Cola that was marketed as a non-alcoholic drink. However, by 1906, cocaine was replaced with caffeine in Coca-Cola. So during this period of time, there's a lot of scientific study occurring on cocaine's pharmacology and its effects, which is why Coca-Cola decided to replace cocaine with caffeine in its drink. Sigmund Freud actually used cocaine and enjoyed its effects, recommending, in fact, that it be used to treat depression, hysteria, digestive disorders, nervous exhaustion, and, interestingly enough, drug addiction. So the Harrison Act of 1914 finally outlawed the uncontrolled use of cocaine. However, after this act was passed, it was still being used by musicians, entertainers, and the wealthy because it wasn't a cheap drug. So this then brings us to the third era, where we talk about the time from the 1980s to the present. So we saw a surge in use due to endorsement by medical experts that it was safe and non-addictive, as well as the media portraying cocaine to be glamorous. It's used to be glamorous. So this high demand, and there was an increased supply as a result, that led to its lowering in cost. So it went from about $100 for one fix to only $10. The United States is the largest consumer of cocaine. And again, this increased demand led to increased supply, which led to the price reduction of about $90. So we talk about cocaine. Well, how is it produced? Harvesting of coca crops brings jobs and prosperity to economically poor Latin American countries. So, in turn, they are ultimately producing the start of what's needed to produce cocaine. So slash and burn techniques to clear the land for the coca bush cultivation has caused deforestation as well as soil damage in these areas. The U.S. has made efforts to eradicate these crops, such as spraying herbicides from aircrafts over these crop fields, but this has also posed health problems to those native populations. And the trafficking of cocaine is so highly profitable that it has simply led to an increase in violence among criminal organizations. So Honduras actually has the highest homicide rate in the world of 82 per 100,000 people. And efforts to shut down the cartels in Mexico simply just moved them to other countries such as the Caribbean. How is cocaine processed then? So those coca leaves that are being harvested by those Latino countries, they're harvested about 2 to 4 times a year. This is then made into a coca paste made out of those leaves. The paste is processed to form a pure white hydrochloride salt powder. That cocaine is then adulterated or cut with other substances such as powdered sugar, talc, and arsenic. Cut cocaine can be from 10 to 85% pure. And it's sold in the form of rocks, flakes, or even powders. So once that cocaine is processed and it's ready for use, we have a few different methods of administration. The first is orally. This method is the least potent and has a slower onset of action. So it's a milder and more sustained stimulation. This form of administration is the least likely to cause health problems and dependence. The second is inhaled through the nasal passages, so it can be snorted through the nostrils. These effects typically occur within minutes and can last between 30 and 40 minutes. The effects here are more rapid and shorter lasting, and rebound depression can occur. It can be injected intravenously. So this is typically the next step that a user would take after inhaling the drug, and they're no longer getting the high they desire. This causes severe side effects and dependence, and these effects typically occur within seconds, but only last for about 15 to 20 minutes after they inject the drug. Dysphoria can even result, leading to a crash, so more of the drug must be administered in order to keep that high going, also known as that binge or run. The drug can also be smoked. So this is as intense, if not more, than intravenous use. The onset of effects is instant, and the euphoria is dramatic, so the dependence is high. The drug is going to pass very quickly through the lining of the lungs and into blood vessels, which is then carried directly into the brain. So freebasing is a method of reducing impurities in cocaine to prepare it for smoking. So in this way, the cocaine is treated with a substance such as sodium carbonate or ammonium hydroxide. The cocaine dissolves along with the impurities, leading to solvents such as petroleum or ethyl ether being added to the liquid to extract the cocaine. The solvent containing the cocaine then floats to the top and is removed with an eyedropper and placed in an evaporation dish to dry. That crystallized cocaine is then crushed into a fine powder and it's smoked through a glass pipe. Other drugs have also been used in conjunction with cocaine. So the first one is going to be alcohol. and this is used typically to relieve the unpleasant effects such as anxiety, insomnia, and mood disturbance, or more severe alcoholism leads to a greater severity of cocaine dependence. So when someone has severe alcoholism, they typically will also have a more severe dependence to cocaine. Narcotics are often used. So heroin is taken to have a more intense high. That's those speedballs we talked about. And depressants are also used. So benzos and marijuana can be used to help reduce the severity of the crash coming off of cocaine. So when we look at attitudes and patterns toward abuse, there is now knowledge about the harmful effects. So this has lessened the view that cocaine is as glamorous as it once was. And we've seen a decrease in chronic and frequent users. There's also a decrease in treatment admissions and in accidental overdoses. So more so today than in the 1980s, people are viewing cocaine use not as glamorous. They're realizing that it has many harmful effects. And we're seeing that come across through the decreases in those who are using, those who are overdosing, and those who are seeking treatment. Crack cocaine is another type of cocaine. So this is a special type of free-based cocaine that is made without the dangerous explosive solvents, and it's known as crack. So you have your powdered cocaine hydrochloride. To that, you're going to add sodium bicarbonate or baking soda and water. This results in crack cocaine. So it removes the impurities and hydrochloride from the cocaine. That substance is then dried into hard pieces. So crack cocaine can be up to 90% pure. Typically, this is smoked in a glass water pipe, and the effects occur within 10 seconds and last roughly 10 to 40 minutes before the crash will happen. So crack and cocaine marketing and use are often associated with criminal activity such as robberies and homicides. There's also concerns of contracting HIV when a user is using crack cocaine because of one, sexual activity that's engaged in to obtain the drug, or because of the disinhibitions about sexual activity that occur while one is under the influence. So they're more likely to engage in those risky sexual behaviors. What are some of the effects then that an abuser or a user will experience from cocaine? So when we talk about the major pharmacological effects, it blocks reuptake and inactivation of catecholamine, so your dopamine, noradrenaline, and adrenaline, as well as your serotonin transmitters, which prolongs the activity of the transmitter substances at the receptor site, which increases its effects. It also has effects on the central nervous system, so it's a stimulant and has antidepressant effects. But it would be ineffective at treating depression and related disorders because it is so short-acting and it has those reinforcing properties that would encourage dependence. So there are differences between, again, that rush versus the high. So the rush are physical feelings of your increased heart rate, sweating, and feelings of speeding, whereas the high are those feelings of euphoria. On the cardiovascular system, it can cause severe heart arrhythmia, heart attack, stroke, and even lung damage because it enhances the sympathetic nervous system, which leads to an increase in levels of adrenaline, which causes vasoconstriction. It is, however, used as a local anesthesia for minor pharyngeal surgery. So these are surgeries that occur in the back of the mouth and the upper throat area. Its effects on pregnancy, so when we talk about cocaine babies, there's arguments that its long-term effects are no worse than the effects of poverty on a developing child when it's born. So, however, vasoconstriction on those placental vessels will interfere with the oxygen and nutrients that are being exchanged between the baby and mother. It can also cause contraction of the uterine muscles, resulting in either trauma to the fetus or premature birth. And when we look at the phases of abstinence, we have three. The first is the crash. So the crash is going to occur about 24 to 48 hours since the person's last binge. Withdrawal symptoms will start to present about 1 to 10 weeks, so you can have depression. Cocaine users are actually 60 times more likely to commit suicide than non-users. It can cause anhedonia, which is the inability to experience pleasure, because again, it's a stimulant, it's an upper, so if you're constantly in that euphoric state, it's going to be very hard then to experience pleasurable effects without it. And it can cause agitation. And then the extinction phase occurs an indefinite amount of time after the person has done their last binge. So how do we treat cocaine dependence? Well, there's no uniformly effective treatment for cocaine dependence. The major differences in treatment approaches are going to include whether outpatient or an inpatient status is deemed appropriate. So an outpatient status versus inpatient, there's a greater control over the patient and regulation of treatment when they're an inpatient versus someone who's an outpatient. They may have more support from their family and friends, and they can be comfortable in their natural surroundings while they're going through treatment. So differences in treatment approaches will take that into effect, as well as which drugs and what doses are used to treat the patients during the various stages of abstinence, and what length of time the patient is isolated from the cocaine accessible environments. So therapeutic drug treatment, it's an intent to stimulate the dopamine activity and relieve cravings. So the intent of these substitutes are to stimulate those dopamine activities and relieve their cravings. Antidepressants can help then to relieve the underlying mood disorders that the user may have originally been intending to try and relieve with the cocaine. Recovery typically is more successful for those who come from middle class, who are employed, and who are married. They're least successful for the addict who does not have a job, has no family, home, and simply no hope for their future. So you can see here that it's important to have support and to have purpose when trying to treat cocaine dependence, if you want to be successful in treating the dependence. So we'll just touch on a few minor stimulants. The first is going to be your caffeine-like drugs, or your xanthines. So these are naturally occurring stimulants that come from over 60 different types of plants. They were first discovered by German and French scientists in the early 1820s. And they're commonly found in coffee from the coffea plant. So in the United States, coffee replaced tea after the Revolutionary War, as tea had become a symbol of English repression. There were penny universities that sprang up in England and France, and they were typically just coffee houses where for 1 penny you could have a cup of coffee, and you could also hear from great literary and political figures. When we talk about tea, this is a plant that's native to China, India, Thailand, among others. And the tea trade was a major element of the English economy, and actually made it possible to colonize India and help bring on the Opium Wars. The Dutch actually are the ones who introduced tea to America in New Amsterdam around 1650. And it's found in soft drinks. So adolescents are actually the highest consumers of highly caffeinated energy drinks. And there's a correlation between those who drink these and a high risk-taking behaviors, or a general lack of common sense for one's safety and health. So I want to make it clear, it's not to say that these highly caffeinated energy drinks are causing high-risk behaviors, but there's simply a correlation between those adolescents who drink them and those who engage in high-risk taking behaviors, or who, again, generally lack common sense for their safety. So caffeine alcoholic beverages were actually removed from the market by the FDA in 2010 due to concerns that the caffeine was masking the effects of the alcohol, giving the consumer the feeling that they weren't drunk, which was leading them to engage in DUIs. This drug is also found in chocolate. So there are small amounts of caffeine in chocolate, and most of the stimulant effect does come from the alkaloid theobromine. And there's actually the Theobroma coca tree was named after this stimulant. It's also found in over-the-counter products, such as analgesic products, such as Excedrin, and vaporizers, patches, even soups, gummy candies, and hot sauces. So it may be in things that you wouldn't typically think of. What are the psychological effects of xanthine drugs? Well, its central nervous system effects can include enhanced alertness, it can cause arousal, and diminish fatigue. So in doses over 300 milligrams is where adverse effects may start to be experienced. Over 500 milligrams, a person may experience dysphoria, panic, nausea, and clumsiness. And when 5 to 10 grams are consumed, you can have seizures, respiratory failure, and even death. So some cardiovascular and respiratory effects include minor vasodilation in most of the body. However, you see vasoconstriction of the blood vessels. So most of the body, you see dilation, where in the blood vessels you see constriction occurring. Caffeine intoxication is actually recognized by the American Psychological Association as a disorder and is characterized by restlessness, nervousness, excitement, insomnia, a flushed face, muscle twitching, rambling thoughts or speech, and even stomach complaints. So caffeineism can occur when frequent high doses of caffeine cause psychological and physical problems. This is actually found in 10% of adults who consume coffee. And while caffeine dependence, so caffeine can be habit forming, it does have a very low abuse potential. We also must talk about over-the-counter sympathomimetics, which are sympathomimetic decongestant drugs found in cold, allergy, and diet medications that have stimulant properties similar to caffeine. These are found in your nasal sprays, oral decongestants, and eye drops. Some sympathomimetics in cold medicines can actually be converted into methamphetamine, however. So this is why certain ones must be kept behind locked cabinets and are only able to be sold in limited quantities by your pharmacies. And we'll talk about herbal stimulants. So herbal stimulants give natural highs. They're used as diet aids, energy boosters, and performance enhancers. Excessive use can cause seizures, heart attacks, strokes, and even death. So in 2004, the FDA actually banned ephedrine and ephedra in over-the-counter products in response to the death of a Major League Baseball player. So these baseball players were using ephedrine supplements to lose weight, and they still continue to use these supplements to lose weight. So when we look at global stimulant abuse, many other countries are also impacted by the abuse of stimulant drugs. So, going back, we need to talk about ATS, you'll see referred to in the next slide. These are amphetamine type stimulants. So, most ATS drugs are synthetic, so they can be produced anywhere and relatively inexpensively. The global market dominated by methamphetamine and is expanding into the East and Southeast Asia. Total drug seizures was about 150 tons per year of stimulant products. Major ATS are a major issue for Asia, North America, as well as Australia, But cocaine actually causes the greatest problems in North and South America. And the United States is the largest consumer of cocaine. So in sum, amphetamines increase the release and block metabolism of norepinephrine, dopamine, serotonin, and adrenaline, as well as block metabolism in the brain and nerves. FDA-approved uses for amphetamines include diet aids and treatment for narcolepsy or ADHD in children. Amphetamine can also cause agitation, anxiety and panic due to effects on the brain, and irregular heartbeat, increased blood pressure, heart attacks, or stroke due to the effects on the cardiovascular system. Designer amphetamines and club drugs are chemical modifications of original amphetamines. Bath salts are unique because they can cause excited delirium, which symptoms include those paranoia, hallucinations, psychotic behavior, muscle damage, kidney failure, and even death. Stimulants are used as performance enhancers to increase both physical and mental endurance. And changes in attitude toward cocaine abuse occurred in the 1980s due to endorsements by medical experts that it was safe and non-addictive. The stages of cocaine withdrawal include the crash, withdrawal, and extinction. The crash occurs in about 1 to 2 days. Withdrawal occurs about 1 to 10 weeks after the last use, and extinction is the indefinite time after use. Approaches to treating dependence include inpatient versus outpatient, as well as the use of drug treatment. Major sources of caffeine-like xanthine drugs include coffee, tea, and soft drinks. The principal psychological effects of caffeine include enhanced alertness, arousal, diminished fatigue, minor vasodilation of most of the body, and vasoconstriction of the blood vessels. There is a correlation between those who drink energy drinks and high-risk taking behaviors or a general lack of common sense for their safety and health. And lastly, dangers of herbal stimulants can include seizures, heart attacks, stroke, and even death, causing the FDA to ban ephedrine and ephedra in over-the-counter products in 2004. So that was your Chapter 10 lecture. I hope everyone has a fabulous week, and as always, please reach out if you have any questions.